Good evening, everyone. Welcome to what we hope will be an informative event around COVID-19 and coping with the stress and mental health challenges created by the pandemic. My name is Zach Williams, and I'm the chairperson of the Skokie Community Foundation. I want to thank and acknowledge the Suburban Healthcare Foundation and the Rotary Club of Skokie Valley for their support of this virtual health symposium on a topic that is affecting all of our lives. Thank you also to Turning Point, the Skokie Public Library, the Village of Skokie Resilient Community Collaborative, and others on the committee who planned tonight's event. Tonight, we will hear from several speakers who will provide local and statewide perspectives and share thoughts about how we can safeguard not only our physical health, but our mental health as well. These guest speaker presentations will be recorded. Because of time constraints, if you have questions for the speakers, we ask that you type them in the chat, and we will do our best to follow up after the event. During the second half of tonight's event, you will have the opportunity to connect with others in the community around an area of interest with topic and resident co-leaders to learn and share practical tips with each other. We believe that by coming together, we will not only get through the upcoming months, we will also build resilience as a community. Now at this time, I'd like to introduce Skokie's village manager, John Lockerbie, who will offer opening remarks about COVID-19 and our community. John?
It helps if I would unmute myself. Good evening. Thank you, Zach. I appreciate it. It's nice to be with you and everyone this evening. Mayor Van Duzen would have liked to have been here, but he is teaching a class at Oakton Community College, and so he appreciates everyone's efforts in putting this program together. You know, the Skokie Community Foundation continues to do great work in the community. I was proud several years ago when the village employees decided to make the Skokie Community Foundation the charity of choice, and so through payroll deductions, a number of our employees are supporting the work that the foundation has done and continues to do. And then more recently with COVID, the foundation has really done a fantastic job and raised $60,000 to support people who have been financially and just negatively affected by COVID, whether they've lost a job or had a death in the family of a key wage earner. And so the foundation selected the Human Services Division of the village to partner and to help distribute and allocate those funds to individuals that very much and families that very much could use that. And so thank you again to the foundation for choosing us as your partner and for all of that fundraising effort. That was very much appreciated. In addition to the Human Services staff, our health department staff has been very busy with COVID. And specifically, I wanted to highlight the contact tracing. We were able to, under Dr. Catherine Kennard's leadership, able to obtain $800,000 in funding from the state in order to put in place a robust contact tracing program for COVID. And they are doing a phenomenal job. Unfortunately, across our country, we do have some areas where contact tracing is not being effective, but I'm proud to say that we're able to contact nearly 98% of positive COVID individuals within our community within 24 hours. And so we're able to work with them as well as the people that they have come in contact with and to help prevent further spread. I should mention that the number one most common reason for spread in our community is social gatherings, whether those are with family or friends or dinner. It is those social gatherings where we are experiencing spread. Helpful for all of us to keep in mind as we are 2 weeks after Halloween and 2 weeks before Thanksgiving. And so if we are quarantining before the Thanksgiving celebration with loved ones, you know, that period has started. And whether or not we're gonna do grocery shopping 2 weeks in advance of that event, those festivities, or you know, just take into consideration various safety precautions. We're within that 2 week window. but I know Dr. Kennard is going to be sharing additional COVID information, but I thought it would be helpful to give a few numbers of the COVID presence in our community. Several months ago, we were only having a handful of new positives a day, but the most recent data that we have is from November 10th and November 11th, and we had 40 positive cases and 34 positive cases, respectively, on those 2 days. And so total confirmed cases to date in Skokie is just over 2,300. And so all of this information is on the Village of Skokie's website, and we continue to update that information nearly daily, but it has been within the last 2 weeks. The data is not as easy to digest and to sort. The state is doing its best to keep those databases up to date, but there is a little bit of a delay in the data. But as we continue to work through COVID together, our community is strong and will come out even stronger on the other side. I did want to highlight a couple of items if anybody is interested, as we are trying to drive home the point, Skokie, we got this. We have a couple of items, magnets for the car or for the refrigerator, and buttons. If you want to email info@skokie.org, we would be happy to mail out these items to you. And we just want to continue in partnership with everyone on this call to do the best that we can as we get through COVID. Thanks again for putting this presentation on today.
Thanks, John. Thanks for your the information and for your leadership. We appreciate it. And thanks for being here tonight. So now on to our keynote speaker. Our keynote speaker tonight is Dr. Catherine Kennard, who recently joined the Illinois Department of Public Health as the medical officer in the Office of Health Protection, where she is currently focused on many aspects of the statewide COVID-19 response. Many of you know Dr. Kennard as the former director of the Village of Skokie Health Department. We are delighted to welcome her back tonight to talk about current COVID-19 trends in the state of Illinois. Dr. Kennard.
Thank you. I am hoping that you can see my slides. Is that true? Yes? Okay. So then I will get to the end. All right. Does that look good? Thumbs up? Okay. Thank you. All right, I'm so delighted to be here with all my friends from Skokie. As you know, I was the director of the health department for 11 years, and it was so difficult for me to leave. It's such a wonderful community, and I especially appreciate being invited to come back and speak to you now in my new role. I've only been here for 3 months, so I'm not going to claim to know everything that's happening. But it's been, I've just really loved being in Skokie and had such a difficult time leaving. So thanks for having me. I do want to begin by acknowledging, as John said, how difficult this has been. All of our lives have been impacted, all of us. And I am going to talk about the data. But I want you to know that the data is not numbers. These are to anyone at Illinois Department of Public Health or to the governor. I know you've heard that during their daily press conferences, but truly, although I'm sure many people who are participating in this symposium have had loved ones they've either lost to the terrible virus or have been ill. And so please know that we are all mourning the loss of those individuals and care very deeply about everyone in Illinois and are working night and day here to make a difference and try to get this virus under control. But also, as John said, there's hope. There's many things that we can do and we, members of our community, can do to help get the virus under control. So I wanted to mention, as you can imagine, there's huge teams working on COVID-19 at the state level in communications and testing and contact tracing, communicable disease, case investigations, outbreaks. My particular role is working with people to prevent COVID-19 from spreading in congregate living facilities, which is long-term care, prisons, and shelters. So let's go to the next slide. Well, if anyone's been paying attention to the news or the daily press conferences, you know the number of cases are going up dramatically, exponentially, 12,000 new cases a day. I don't know if you remember back at the beginning when the governor had his, the people who are doing modeling, predicting, but they pointed out that the first wave, which was as bad as it was started just by a handful of people. This second wave is because of thousands of individuals in the community. And so we are seeing a tremendous increase in cases. People have asked, well, when do you think it's going to peak? We can't really say at this point, but we are doing everything that we possibly can to try to limit the number of cases that are occurring in the community. There have been more than 500,000 cases now in Illinois and more than 10,000 deaths. And so it's really upon all of us to do everything we can. And I'm confident everyone participating in this symposium is wearing masks, social distancing, staying home when you're sick. But that is something we need to continue to emphasize to others in our community. As John said, sometimes people don't think when they get together with their family members that they could become ill, but it does happen that way. So, and the same thing in the workplace. Sometimes people just are losing not having their guard up. They're having lunches together and not wearing their masks, not socially distanced, and that's where we're seeing the spread. And it's not because anyone's a bad person or not doing the right things. It's just that, you know, we're all tired, but we have to maintain our vigilance at least for a while longer. I'm going to just go through a couple of slides on WHO's, and this is all information from the Illinois Department of Public Health website. This is broken down by race, so I think it's a little bit confusing, but I'm going to talk about race in just a minute because I know equity is also part of your conversation today. Age. Most of the new cases, I'm sure you've heard on the news, are in the younger individuals, 20 to 29, people who are in college, people who are going out to bars and socializing. So we are seeing that younger individuals, but there's still plenty of individuals, as you can see from this graph, who are over 50, who are still becoming ill with COVID-19. And maybe it's an exposure at work, but more likely it might be their social gatherings. However, when we look at deaths, 90% of the deaths have been over the age of 90, 90%. But when people see that, I think many people think, oh, those must be people in long-term care. Really, the majority of those individuals are living in the community. They're people like my parents in their 80s who are vibrant and living out in the community. They're not individuals living in nursing homes. We've done a tremendous job reducing the number of cases in nursing homes. And that's one of the things that I've been involved with. So I think, again, it's important for us to know that even if you're younger, you can spread this disease to others in your family who you care about, who may be in higher risk categories. Just a quick look at what's been happening. I'm trying to get this on our website. Our public information officer told me my slide was too complicated, but really this shows over time. The blue is staff, the red are residents of long-term care. Before there was even a case identified in a long-term care facility, Governor Pritzker and Director Ezekiel put in place restrictions in long-term care where no visitors could come in, staff were being screened. Then if you see here, we had this huge, terrible wave. We all know, we heard it, it was on the news. But tremendous amount of effort, funding from the state to the long-term care facilities, working with them to put in place infection control measures. They had led to a dramatic decrease, isolating people who were ill, making sure everyone had personal protective equipment, dramatic decrease in the number of cases. And at the end of May, an emergency rule was put in place by Governor Pritzker requiring outbreak testing routinely if there was an outbreak in the facility, and also that they had to have plans. We strengthened that the end of August, mid-August, with a plan that requires surveillance testing, because once there's no disease in the facility, the staff are the ones who are going to bring it in. And so we need to check them regularly and do testing. They may not have symptoms. They may not realize that they're going to have it, but they need to be tested, and that's what we're doing now. So this is back to mid-October. The numbers really haven't changed. Even though we've now had that huge increase in cases in the community, there has been some trending up in long-term care, but this is a success story that I wanted to share with you because I'm sure many of you probably have loved ones who are in long-term care facilities. The groups most impacted by the disease, as I think you've also heard, are racial and ethnic minorities. They are disproportionately affected. This is a graph again from our website. You can see over in the green, about 30% of the cases we don't have race data on, just because people don't have to tell us what their race is. That's self-reported. And so, but then when we look at the deaths, the number of deaths in the Black and Hispanic community are 2 to 3 times higher than what they should be based on how many of them are in the population. So the Illinois Department of Public Health and Governor Pritzker are laser focused on equity and making sure that everything we're doing is done in an equitable way so that everyone has access to testing and will ultimately have access to vaccine. In fact, there's an entire team just devoted to looking at all that we're doing through an equity lens. And we know, as it says here, that Blacks and Hispanics are dying at a greater rate because of our social, structural, and institutional inequities. It's been in the news a lot. It's not something that should surprise anyone. But I wanted you to know that we are very much focused on equity with everything we're doing. So here we are looking at the state. Numbers are going up dramatically. Many of you may have seen this. You may not know what is mitigation. Mitigation means measures that we're putting in place to help reduce the level of disease in the community. This is map of Illinois has actually even changed since I put this on here. Most of the counties are orange. And when you're in orange, that means that you're under mitigation because your cases are too high, maybe your hospitals are getting overwhelmed. We are seeing increased hospital utilization. And in some areas of the state, that's getting to be quite severe. Or fatalities. And so there's a number of measures we look at, but orange means that those places are under mitigation. I know Cook County is under mitigation where Skokie is, and all of this information about the different measures that can be put in place about limiting the no indoor dining. And it's based on, talking about social gatherings, just as John Lockerbie said. Trying to look at the data that we're receiving and then get that information out so that you can make appropriate choices and we can help communities limit the disease spread. Just a word about testing. This is unbelievable. The state has now tested over 8 million people for COVID. The state, within the state, all together. It's not only the state of Illinois labs, but hospitals and laboratories and the Illinois Department of Public Health Laboratory all together are now testing over 100,000 people every single day for COVID. This is a success, regardless of what the outcomes are. This is a tremendous success and a tribute to our state and all of us working together. John Lockerbie already mentioned contact tracing. I just wanted to say it again. This is something that public health does all the time. There might be a case where there's a meningitis in an athletic team, and we have to identify who the kid played against and who they were in close contact to so that those individuals know that they need to get medication so they don't get meningitis. So that's a day-to-day thing. There's nothing new about contact tracing. And what happens is when someone is a case, when they've been diagnosed with COVID-19, the health department will contact them and find out who they've been within 6 feet of for 15 minutes or longer. And those individuals then are at high risk of getting the disease. And so we reach out to those individuals, not revealing who they've been exposed to. So that's always an anonymous situation that we do the contact tracing and then identify who has been exposed. Am I coming through okay? It looked like I might have gotten a little jiggly there for a minute. Okay. All right. Main sites of exposure. Social gatherings, yes, but restaurants and bars, schools, workplaces, hospitals, clinics, just about any place that people gather. This again is on our website, the Illinois Department of Public Health COVID-19 website, which is a great place to find all kinds of information that's of use. But really, it is social gatherings that are largely driving this disease at this point. So I wanted to mention what is isolation and quarantine in case you don't know on here. What's when a test is positive? If your test is positive, then you must stay away from others for 10 days, either from the day of your symptoms started, if you had symptoms, or the day the test was done, if you did not. And so that's called isolation. You're isolating yourself. You're staying away. Someone's bringing you food and so forth, and you're staying away from others for 10 days so that you don't infect anyone else. How about if you're a contact or if you're exposed? Again, that's within 6 feet for 15 minutes. But then you need to stay away from others for 14 days because any time during that period, you could become ill with COVID. And so that's why we say, sometimes people say, well, I don't understand why these are different. But the CDC has not gotten virus that was viable after 10 days of someone being sick. And so really they're mostly shedding towards the beginning even of that illness. But that's why we say 10 days, because there's no evidence that people can be infected after the 10 days. There's a lot of nuances, of course, and you would work with your local health department for your particular situation. But in general, this is the case that when you're in quarantine, we're worried that you might become ill and then infect others. So that's why we say, if you're a close contact, you should stay home for those 2 weeks. Looking to the future, I just wanted to say a quick word about mass vaccination or large-scale vaccination. We are planning at the state to vaccinate 80% of the population because that's what's needed in order to get herd immunity. The city of Chicago will be getting its own supply of vaccine. So the state of Illinois has plans that are being developed now to vaccinate 8 million people with up to 2 doses of vaccine. And the draft vaccination plan is on the website at this link in case you would like to look at it. Oops, I apologize, I went backwards. I'm looking at you and not looking at down here. Safety and effectiveness are our top priorities. Dr. Skokie and the governor have made it very clear we will not be giving a vaccine unless it's safe and effective. And so that's going to be the plan going forward. We have to be convinced that this is a safe and effective vaccine. And I will get it myself. So I don't want anyone to have any doubts about it. I would have my family get it. It will be safe and effective. There's a lot of different vaccines under development, and so we're planning for different scenarios. But just like we saw back with H1N1, there's likely going to be a limited supply. And so there's going to need to be, just like we saw with H1N1 back in 2009 when we vaccinated lots of people in the community, there will be priority groups before, but then more and more vaccine will be produced. 2 doses are probably going to be needed in order to get immunity. We do know the vaccine will be at no cost. It's going to be provided by the federal government. However, depending on where you get the vaccine, the person who gives it to you, the provider, your doctor's office, for instance, might want to charge an administration fee. Those details haven't all been worked out, but insurance plans and so forth will cover that fee. How are we deciding who gets the vaccine? Well, this is being decided at the national level by the Advisory Committee on Immunization Practices, just as all immunization recommendations are made by that group. So it's based on these 4 criteria. Based on your risk, do you have high risk if you get the infection? Do you have the risk of, how likely is it that you are going to get the infection, meaning the risk of acquiring the infection? How likely is it that you will have severe disease? We say a negative societal impact, and this will be more clear on my next slide. And then what's your risk of infecting others? And so we are looking at all of those things. When we talk about societal impact, we're talking about critical infrastructure work, people, you know, first responders. You got to have an ambulance, you got to have police, right? So we can't have the police force knocked out. So the first phase, when we get our first amount of vaccine, it's going to go to health workers, people who are working in hospitals, people who are working in long-term care, people who are taking, when it says high risk, they're taking care of individuals who are likely to have severe illness or severe consequences, and first responders. Also, very close to that, we will be taking care of people who have health conditions that put them at significantly higher risk. If you have obesity, or if you have diabetes or heart disease, some of the other underlying health conditions. Older adults living in congregate settings, meaning long-term care. There's a whole list in phase 2, and the hope is, you know, globally, a tremendous amount is being put into this. So I think it will be, we will hopefully get vaccine out fairly quickly in large quantities, but not by the end of 2020, more like early next year. However, so the plan now currently is for teachers and school staff. We want our kids to be in school, critical workers, the people who keep the lights on, people who make sure the sewage is taken care of, and so on. This would be the second category of individuals who are more likely to have not as severe disease. People in homeless shelters or group homes, prisons, jails, and then any older adults who weren't already taken care of. At phase 3, young adults. When the vaccine, right now the studies being done on the vaccine are not being done on children or pregnant women. And so those groups will be taken care of a little bit later when we have a chance to study the vaccines and make sure they're safe and effective for those groups. And then finally, everyone. We're going to get to the point where we'll have enough vaccine to vaccinate everyone. So I just want to conclude by saying that it's up to all of us. There's many things that we can do. We know the messages. Wear a mask, stay 6 feet away from others, stay home when you're sick, wash your hands. And then another final consideration is to get a flu shot if you haven't already done so, because that will help protect you from a different respiratory illness and lessen the burden on the healthcare system. So for more information, you can go to our homepage. There's also the COVID hotline and our email, which are manned, regularly answered every day, that you can, you know, weekends included. So if you have additional questions. So thank you, and thanks again for having me.
Dr. Kennard, it's Nancy Kim Phillips, and there have been some questions in the chat. And what is your recommendation? Is it this information here? Because I know we don't have time for questions for you right now, but what is your recommendation on how to get those answered?
If you can send them to me, I can take a look at them. I'd be happy to look at those, but also these are good resources. And I will be honest, every day I have meetings, you can imagine every half hour I'm getting hundreds of emails every day. So I will do my very best. Either if I can't get the answer, I'll give those questions to others who can. How about if we leave it with that? We do want to be accessible, and there's people ready and willing to answer questions.
Thank you, Dr. Kennard. We appreciate this very timely information and all of your leadership to keep us healthy. And thanks for coming back to Skokie to.
Oh, sure. Happy to see everybody.
Okay. Our next speaker is Cordelia Lutz-Gowan. Cordelia is a licensed clinical social worker who leads the open access program at Turning Point. She will share practical strategies and reassurance for meeting the challenges of COVID-19. Cordelia?
Thanks so much. Good evening, everyone. I'm thrilled to be here. Thank you for having me. I'm a psychotherapist and manager at Turning Point Behavioral Healthcare Center in Skokie. And yeah, thrilled to be here. So let's get started. So this is our agenda for our time together. We don't have a ton of time, and I have a lot of information I want to share, so we're going to be going at quite a clip. but you're welcome to put questions in the chat and I'll answer them as I can, or I'll get to them later and share that information later through Nancy. Wonderful. So this just explains how you use the chat. So I want to start off by inviting you to do a little reflection with me. Take a moment for yourself and think about what is going on in November 2020 for you, and how is that different from November 2019? How are you feeling after over half a year of COVID as we transition into winter? I imagine many of you are feeling anxiety, stress, dread, exhaustion, fatigue. All of those feelings are valid, and we're going to talk a little bit about how to manage those emotions and especially that stress. So, quick quiz. Which of the following are associated with long-term stress? Hair loss, higher cholesterol, decreased immune function, bloating. I can't see all of you, so you're welcome to put in the chat, or you can quickly unmute yourself and just shout it out. Anybody?
All of them.
All of them.
Yes, all of the above.
All of the above.
You are smart. You are great. You're correct. It was kind of a trick question. Clearly, I can't trick Skokie. So yes, all of them. This is a little infographic from Pick the Brain that kind of shows the effect of stress on all of our body systems. I want to just highlight two. You might have heard or perhaps experienced COVID fog. This is that kind of like cobwebs in your mind, you're like fatigue, can't remember stuff. That's really common after a period of stress of long duration, which we're all going through, right? This is a stressful and traumatic time for all of us. The other thing I really want to highlight here is joints and muscles. Not only does stress cause, aches and pains, but for any of you who are working from home currently, you might have had to cobble together some kind of work environment. I know I had an employee who for the first 6 months of COVID was working from her couch, right? So that is probably affecting your body as well. So now we're going to transition into talking about how to handle these things and take care of ourselves. But before we do that, I want to just put in a plug that sometimes it might seem as if we're experiencing stress, but it's actually signs of a more serious condition like anxiety, depression, burnout. If that's the case, a professional like your general practitioner, your doctor, a therapist, social worker can help you figure that out and get the support you need to do better. And we'll talk a little bit about that at the end of the presentation. All right, so these are all ways to manage stress. We're going to go into them a little bit deeper. Got self-care, mindfulness, sleep hygiene, nutrition and exercise, getting outside, and professional support. So depending on your community, your family, your profession, self-care might be something that you think about a lot. I know it's something that therapists kind of talk about all day, it feels like, or it might be something that you're hearing about for the first time. So I want to go into that a little bit and talk about what I mean by self-care. Self-care is basically working to meet your needs with the goal of maximizing your potential in other areas. At the most basic, it's making sure that you're fed, hydrated, and rested. And once those are taken care of, you can work on other things like feeling a need to be creative, meeting your need for socialization. And everybody, for different people, it looks different, and it's going to look different on different days. So let's talk a little bit about what it might look like for you. I think when I hear self-care talked about in the media, a lot of times I see these pictures of like bubble baths, manicures, like a glass of wine, things that can really be expensive and indulgent. And it really doesn't have to be that way. Sometimes it can be just like going for a walk, staring deeply into your dog's eyes, doing something that kind of fills you up. Also, it can be really boring. There, at the bottom of the screen, you can see there are these merit badges called Boring Self-Care. And I include these, they're from an artist named Hannah Daisy. I include these as a reminder that it doesn't have to be about spending money or doing something luxurious, right? It can be, oh, I'm gonna clean that dish that's been sitting in my sink for a few days. Especially when you're going through a period of heightened stress like we all are right now. Boring self-care is about taking care of yourself to get through today and make it to tomorrow. So after self-care, something I want to touch on is mindfulness. Mindfulness is kind of similar to meditation in that it's about cultivating a state of awareness, being in the present, really, really helpful when you're feeling anxiety or stress. If you're new to mindfulness, it can be a great way to get started is to use an app on your phone or computer. And a couple apps that I really like, I've listed on the screen. My absolute favorite is Insight Timer. It allows you to search guided meditations, and you can search by duration, gender of the reader, whether they're religious or spiritual, whether there's music. If you're interested, my favorite one is called Breathing Break. And it's read by a man who sounds like the late Sean Connery. It's only 2 minutes long, and he walks you through doing some deep belly breaths. It's very soothing. So highly recommend. Also, if you have access to YouTube, there are a lot of mindfulness exercises there. So when we talked about self-care, I mentioned sleep. We all know we need sleep, right? But sometimes when you're getting ready for bed and you're actually pretty tired, it just doesn't work to get sleep. And that's where sleep hygiene comes in. So sleep hygiene, in short, is best practices for getting a healthy, good night's sleep. And this I really want to draw your attention to, because as we're spending more time in our home, some of us are working from home, some of us are teaching kids remotely from home. There's a lot of stuff that's happening like in our homes or maybe even in our bedrooms that we used to be able to keep separate and keep boundaried, and that can interfere with our sleep. So just some things to consider if you're having trouble sleeping. It's great to limit screen time before bed. Maybe the hour before bed, you get off your phone, especially, if you're feeling a little nervous about some of the news. Just like kids need a bedtime, so do adults. And if you can figure out a good bedtime routine for yourself, it can make getting to sleep a lot easier. Finally, limiting caffeine intake is really important, not just coffee, but also caffeinated sodas. And that can look like setting a limit, no more than 2 coffees a day. And it can also look like saying, after 2 p.m., for example, or a time that works for you, I don't drink caffeine. So next, I want to touch on exercise and nutrition. Even a little exercise is better than none. And with maybe you don't feel comfortable going to a gym, or you had a workout buddy before and now you're social distanced from them, we have to be creative during COVID, right? So if you're working, stretching at your desk or getting up and taking a lap around your apartment or your block is really good. It boosts our mood. It's a nice distraction from the stress we're going through. And adding onto this, trying to eat healthy, limiting your caffeine again, and also being aware of how much sugar you take in, because that can also be a stimulant, and stimulants do contribute to anxiety and stress. So we all live in Northern Illinois. I guess it's possible that some of you don't and you've tuned in from, I don't know, somewhere warm and beautiful like Hawaii maybe. And if you do, good job. But I wanted to include this picture as a motivator and a reminder for us in Chicagoland as we enter winter. This is a Scandinavian baby, and this baby is napping outside. And if you look at the thermometer, it says -10 degrees. It's probably Celsius, which is really cold, but even if it was Fahrenheit, that would be really cold. But this baby is doing it, right? It's getting fresh air, it's getting, whatever little vitamin D it can get in Scandinavia in the winter. And we need to be like this baby this winter. Figure out ways that you can safely go outside and get that fresh air, get that little bit of sun that we're going to get, because it's going to make a big difference in your mood and your stress levels. I am not saying put your babies outside. Please consult your pediatrician before you do that. I do not endorse that, and neither does the Skokie Library. But for ourselves, adults, we can layer up, we can do it. Next, I just want to touch on self-care and coping are really important, but like everything in life, we need to practice balance. Here, having a piece of cake is not bad, but Tina Fey might not really feel good after she eats this whole cake, and Amy Schumer likes to unwind with a glass of wine. If she has an addiction history or troubles with substances, that might not be a safe coping skill for her. And this guy in the middle, a little online shopping, great, but be careful, around your budget. And if this is something that you're struggling with, you feel like maybe you're overindulging, or things that were feeling good before and helping you manage stress aren't working anymore, that is when it can be really helpful to meet with a professional to get some support around how can we make this work. I think the thing I want you to take away from this presentation around seeking out a therapist is that everyone deserves someone to listen to them, and everyone deserves support navigating life's challenges. And that's something that you can access through your insurance, or there's a resource sheet that you'll get from Skokie Public Library that will give you some more tips on that as well. All right, so we're getting close to the end of my part of the presentation. So I want to talk about the holidays, right? We talked about self-care, the cold weather that's coming. The holidays this year are going to look really different for most of us. And we're going to get through it. We're going to survive. But in order to do that and to kind of deal with feelings of sadness or grief that are going to come up, we need to make a plan, right? And this is something that you can do with your family. It's something you can do on your own or with a friend. But here are my tips for how to do it well. So the first thing that I think is going to be really different for a lot of people is socialization and connection. So make a plan. How are you going to connect around the holidays? Do you want to schedule a phone call? Do you want to schedule a video chat? You might be really bummed about the traditions you're missing, that family member's one famous dish that you can never figure out how to make. So this is a great year to experiment with a new tradition. Cook something new, try something different. If you don't want to make it about food, what's an activity that you can do that you haven't done before on a holiday? That's fun. Along with that, plan purposefully things that are going to boost your mood. Do you want to make a playlist so you're listening to music? Do you want to watch a really funny movie? Plan those out, And when I say plan, put a reminder in your phone. Write it down in your calendar. Do something so that you'll have a reminder when you start to feel the weight of this very different holiday, so you can help yourself kind of take care of yourself in that moment. Gratitude is a fantastic tool, and there are many, many hard things about this year. But my guess is that everybody here has at least one thing that they can be thankful for and appreciate. And it's important that we take time to acknowledge that, whether it's journaling, writing a thank you note to somebody, that can really help boost your mood as well. And finally, remember, we're going to get through this. It will end. We don't know when, but we will have normal holidays in the future. There was one question in the chat that I got The presentation will be available to view later. I've shared my slides. And then the mindfulness site that I love is called Insight Timer. But you can also look for anything on YouTube. Just Google mindfulness and you'll find some good stuff. And my favorite breathing exercise is called Breathing Break. It's under 3 minutes and it's with a Scottish person. So thank you so much. We're going to transition now into our breakout rooms.
Thank you, Cordelia, for your presentation and for setting the stage for the next part of our program. When everyone registered for tonight's event, you signed up for a topic of interest. At this time, you will join others in the group you selected, where we look forward to continuing with presentations and conversations co-led by topic experts and village residents.